Okay, doctor, can you mention some of the tips to control low BP problems in PD patients?
So, in low BP happening in PD patients or in any other diseases also, so we should be more careful while standing up. So, while lying down and then standing up, we should do in a step by step process. So, first we have to slowly sit and then stand up slowly. There should not be a sudden change of movement. So, that will affect the balance issue also.
Okay.
So, next tip is to drink lot of water.
Okay.
Plenty of water will increase the blood volume and
Okay.
therefore there will be a high rise in BP rather than the low BP.
Okay.
So, next is exercise. Regular exercise will help in reducing the low BP issues in PD patients and avoid more inactivity phases. So, we should be mentally and also physically we should be more active. And if by checking with the doctor, they can include slight salt. If they are taking any BP medication, whichever time they are having low BP, they can add some salt drinks like lemon with some salt and all. That will reduce the BP issues, and check with the doctor which medicine is causing the low BP and try with another brand or another combinations.
Okay. Okay, doctor, can you tell me about the drooling of saliva in PD patients?
Most of the patients which are in chronic phase, that is in the 3rd to 5th stage, those patients used to get this symptom as drooling of saliva.
Okay.
So, in drooling of saliva, what happens is the mouth muscles will be there, that muscles will be weak.
Okay.
So, the drooling of saliva happens, and also inability to swallow. So, inside the mouth also the small muscles will be weak and slow. That will happen, that will cause the inability to swallow the saliva. So, in a normal process for us and all, whatever saliva is coming in our mouth, we swallow it.
Yes.
For them it will not happen. So that the drooling happens.
Okay. Can you please give me a explanation about this symptom?
So, constipation is seen in most of the PD patients.
Okay.
So, this symptom is seen 10 years, even 10 years before the appearance of motor symptoms. Motor symptoms means this tremor and other seeable things. So, constipation starts earlier. So, constipation issues happen as GI issues, start with GI issues like gastritis and all, and if left untreated it will become constipation, and constipation is also a symptom of Parkinson's also. So, there are researches that there is a gut microbiome, that is a microbiota in the gut influence the brain. That is also seen in Parkinson's also. As I have mentioned, alpha-synuclein is there, that is transfers through the vagus nerve to the brain. This destroys the dopamine. In the dopamine producing neurons in the brain. So, the treatment specified for constipation will help in Parkinson's also. Whenever the symptom of constipation is reduced, Parkinson's symptoms also seems to be reduced. In Ayurvedic way, we can take the laxative medicines like Gandharvahastadi, Erenda Taila and Triphala. All these are helpful in relieving the constipation, and also Vasti therapy, as I have mentioned, reducing the Vada. So, in Ayurveda there is called a disease called Udavarta. Due to this also, that is upward movement of Abhana Vada. That is an Ayurvedic concept. So, in that also, because of upward movement, there is no downward movement happening. Because of that also constipation happens.
Can you please tell me some tips for this, ma'am?
So, drinking plenty of water is a good thing which we can do, and including a high fiber diet. High fiber diet include fruits, vegetables and all. These will manage the constipation level. So, main pathophysiology is the muscle issue happening in the large intestine and all. So, but along with that, if we go to the good quantity of drinking water and the diet part, it will be manageable along with Ayurvedic measures which I have mentioned.
Okay, thank you doctor for this valuable information. Thank you for today.